ಅಡಿಗೆ ಹೌದು ಮಾಡ್ಲಾ. Good afternoon, everyone. I am Dr. Kantikar, former member of National Consumer Commission, and at present I am in Subbaya Institute of Medical Sciences, Shimoga, the Department of Pathology, as a teaching faculty associate professor. We have started the medico legal lecture series for the last 3 months, and this is the fourth lecture in the series. The topic today is the doctor patient relationship and duty of care. I'm sure you all are aware of medical malpractice, the terminologies, medical negligence, and medical law, and different ingredients of medical law. What is doctor patient relationship? What is the relationship? Why there is, as such, we say doctor patient relationship should be there? It is, in simple word, it is a consensual and fiduciary partnership built on trust, empathy, and effective communication between doctor and patient. It is a broader aspect and it directly influences the patient's satisfaction, the treatment structure, and the treatment outcome also. With this brief outline, let us move to the subject today. First, let us understand the health consumerism. Now, the present scenario, present era is the electronic era. It is a consumer driven healthcare system now. There is a huge shift from the current doctor driven care, and the patients are making their own decisions with their doctors with the help of digital health apps. Therefore, there is a change in doctor patient relationship. See, the thing is, now there is saying that can you trust your doctor? This is the notion now. Now let us move. What is actually doctor patient relationship? It is a complex, unique, and multifaceted, evolving as the time evolves with more time. It reflects your quality of healthcare, diagnosis, and treatment. The patient must have confidence and in your competence or their doctor. This relation build a solid foundation of trust, empathy, and respect for the patient's rights and dignity. Let us understand what are the different rights of the patient. What patient expects, he had also rights. Be treated with respect, obtain medical records, privacy of the medical records, that is confidentiality, it is very important in the doctor patient relationship. To make a treatment choice, informed consent is also the best way to maintain doctor patient relationship. If the patient refuses the treatment, yes, you have to give weightage for it also, and making decisions about end of life care. There are four modules. Doctor patient relationship, it is a broader term. Then the Ezekiel and Linda Enamel, they have laid down 4 modules of doctor-patient relationship. It is their paternalistics, informative, interpretive, and deliberative. What it is? Little confusing, all are overlapping, but I have made it little simple for your understanding. Paternalistics is the physician or the doctor. He will take the decision. He will tell the patient, yes, I know the things, I will treat you, don't worry. Doctor decides what is the best for his ailment, the patient's ailment. Second is informative model. The doctor will explain the patient all the relevant information about his disease, risk, treatment, available treatment modalities, risk and pros and cons, whether there is a treatment or not, or any alternative, and then leave it to the patient to decide whichever you want. Doctor will explain and then leave it to the patient. It is an informative model. Then third is interpretive model. What it is, interpretive? The doctor will explain everything, the pros and cons and everything. Again, suppose the patient is diabetic or renal failure is there. Doctor will tell, he will interpret, see, going for diabetes, you are highly diabetic. Going for dialysis will be the best mode of treatment here. Your chances of cure or the other morbidity will be lessened. So doctor will interpret everything, pros and cons, and leave it to the patient. For example, suggesting dialysis in the cases of, because patient, he may or may not accept going for dialysis or not. Then the deliberative model, it is one way to advisory, deliberative. If the doctor and one doctor had one friend, the friend is smoker. He will tell the friend, don't smoke. He will tell the friend what is the healthy lifestyle and stop the smoking. Okay. Now we have seen the 4 models of the doctor-patient relationship. Now, whether every time we have to maintain the good relationship, what will happen if there is a breach in doctor-patient relationship? It is the spark. It is the slide itself explains, if there is a breach in doctor-patient relationship, it sparks litigation. Why there is a breach in doctor-patient relationship? The patient will feel, patient has approached you and patient is admitted, and the feeling of the patient is that they were not heard, they were not attended to. Suppose patient is coming to your OPD, or somebody, the doctor is busy in his mobile. That time patient will feel, definitely he will feel that doctor was not attentive, he was attending the phone and he was neglected me. Nobody seemed to have cared him. Then in the hospitalized patient, it is a bad outcome. That is also a breach in patient doctor patient relationship, or unexpected results also. Then heavy economic loss also, because of the billing and because of unawareness of the treatment modalities. The doctor, because there is a duty of the doctor to explain, this is the treatment, I am treating this, the budget, the cost of treatment, you need those medicines and other things also. And if there is no cure, this is the main thing, to the why there are constraint in doctor patient relations, the no cure. The patient will say, I came to you with the hope that you are the best doctor, my cure will be there, but there is no cure, I am going back. then not issuing medical record. Yes, it is also one of the major issue in the breach in doctor-patient relationship. Many patients or the relatives, they grumble. We ask the hospital to issue the record, but the hospital has not issued the record, and the litigation will start. Now, what is the present scenario? I'm talking about what is the present. Is there any good doctor-patient relationship now? Now the patients become strained for the several reasons. One is over medicalization and over specialization. There are number of hospitals, number of medical specialties, and over specialization. Patient want patient don't want to go to family physician. He want to go to super specialist, and his expectations are very high. The patient's expectation, I should be seen by the neurosurgeon. Despite my headache, he will not go to the family physician. He will go to neurosurgeon or neurophysician. His expectations are more. And if he is denied consultation, then there will be constrained relations between doctor-patient relationship. Now, because of the technology also, the doctors are putting more reliance on the technology, and it increasing the cost of the treatment. Therefore, the patients are strained, and there is a constraint in the doctor-patient relationship. So we need to reiterate, the patients need to be treated holistically, catering for their physical and mental or social needs. Doctors too need to better understand not only the patient's sickness, but also their social, cultural, and economic profiles, and above all, their expectations also. Doctors should come up to the expectation of the patients. At least empathy is there. Now, few words about how you will maintain the good relations with the patients. Avoid being business-like. Be courteous, because the perception of public at large now is doctors are commercial because of the corporatization, the hospitalization, more hospitals, corporate hospitals. They patients, they think it is a business. If you are a private consultant, don't avoid being like a businessman. Give time to the patient. Settle down in the consultation room. If the patient enters and puts few words, how are you, where you are working, what you are doing, just a few good words, he will calm down and he will be very happy. What is communication? The communication is the main, very crucial issue to maintain good doctor-patient relationship. For the good outcome, the bad communication, it itself results into errors, financial loss, and further land into litigation. The doctor-patient interview also, there should be good interview between doctor and patient. The consent is important. For every patient, you need not take the consent. When the patient enters in your consultation chamber, it is an implied consent. He agrees. He agrees. Your receptionist will send you inside your chamber. He agrees. Yes, let the doctor examine me. And you also agreed, I will examine this patient. That is implied consent. And then what are the problematic areas? In the communication, breaking bad news is the problematic. Disclosing death, handling aggressive patients, it is also very tough. Handling the families, the violent families, also emergency. These are the problematic areas where communication needs very diplomacy. Then the medical interview. It is not like a office interview or anything. Just greet the patient, establish good rapport, listen patiently. Many times, what happens because of busy schedule? I agree, doctors are busy, but with patient will come with the hope. Patient will come with the hope. My ailment, he is the God. He will solve my problems. He will listen my few words. My pain, he will take care of my pain. So if you won't listen patiently, then definitely he will be not happy, and that will constrain your doctor-patient relationship. Then favorable body language and sitting, dressing up, sitting posture, eye contact, and hand movements. It you have to adapt yourself. It is not to be taught how you should dress, how you should sit in the posture, because it is your chamber. That should be pleasant look to the patient also. The eye contact, just if you are you don't put goggles and other things in your chamber, and like Rajnikant or any, you don't be like a villain. The patient should be impressed by seeing you. Yes, I came to the proper person. Show empathy, be patient position, show empathy. You sit in the patient position, that yes, if I am the patient, what would I have been done? Avoid unnecessary medical jargon. Yes, don't tell medical jargon. Don't put, avoid medical terminologies. Your ECG is showing ST elevation and other things. Why you are explaining ST elevation? If you are seeing the ECG, there is some problem. Don't avoid medical jargon. The terminology, medical terminology, he will be afraid of. Avoid those medical jargon. Don't be judgmental. Immediately, don't judgment. You send the patient for the investigations and other. Yes, you had fever. Yes, there is an epidemic of dengue. Let us investigate. Don't worry, it is not dengue. Let us rule out other causes. Don't judgment. Oh, there is dengue. Yes, in your area dengue, you are suffering from dengue. Don't be judgmental. Then definitely he will be more worried. Be clear in your talk and brief and specific. Have a positive attitude with smile. Be calm and assertive. Adapt to audience, because sometimes with patient, his mother or sister or few other two members will come. They will ask few questions. Don't get irritated, and just have a casual talk. Then be open minded. Then it is the breaking bad news. It is also one of the tag. You with the senior doctors, with the take the help of senior doctors, take the patient's relative in separate room and give them time and explain with their own language and softly, and convince them what happened, what are the possibilities and other. There is one term, agree or disagree. If the patient don't agree your treatment or your saying also, don't be furious. Yes, he won't agree, because every patient has its his own autonomy. Remember, autonomy is the highest pedestal in the medical law. So don't be, if he don't agree, that's all. So if he disagree, if he agrees, well and good. And the tact and dignified diplomacy are the keys to successful and long-lasting doctor relationship. Your tactics and diplomacy will certainly help to maintain good doctor-patient relationship. Yes, this is very important. I have chosen this slide. Avoid developing private and personal relationship with your patients. Many times this is seen, this is highlighted in the medias. Doctor has committed some offense with the patient, some affairs with the patient, and these are coming in the media, and it is a fact also. So avoid private and personal relationship. Don't accept unwanted gifts from the patient, or you don't try to give the gifts to the patient. Don't favor the patient, and the patient, the personally or privately involved with you, discourage the patient if patient want to involve with you privately or personally. It may harm you at some point of time. Then maintain secrecy also. It is very important to maintain good doctor patient relation. Secrecy for the medical publication. Be careful if you are showing any x-ray or any specimen or any patient's examination, conceal his identity. See in this film there are details. So conceal the patient's name and other things. But here again, very important, patient consent is necessary, that I am using for your X-ray for the research and other thing. So remember the doctor-patient relationship, when it exists, the doctor has abide by many regulation. As long as there is a relation, he is abide by regulations. The deficiency in service can make the doctor liable under the Consumer Protection Act, civil or criminal laws. Now, when the doctor patient relationship ends, when the doctor patient relationship, whether it is continuous, the doctor patient relationship ends when the patient is cured, or sometimes you have to end the relationship, it is abandonment. Sometimes you have to abandon the patient doctor patient relationship. There are certain reasons. Sometimes the patient's behavior and the other issues, you have to abandon the doctor patient relationship. So remember, the good doctor patient relations are, it is a balancing act and diplomacy. A doctor can do a lot more with his words than his medicine. Have a relationship of fish and water. Read this. Have a relationship of fish and water, not of fish and fishermen. So remember this. If you maintain this, there will be good doctor-patient relationship. So this is about the doctor-patient relationship. And the second part, today I will deal with the duty of care. So till then, the doctor-patient relationship is also associated with duty of care. What is duty? What is duty towards the patient? Duty? What is duty in general? You all are aware. You are working people. You are working persons. You are working somewhere. You have your consultation. You have some duty towards the society, towards the patients, towards your family, towards your nation, and other. Now, what is duty? What is duty of care? We are saying duty of care. What it is? Duty of care is the fundamental legal obligation. I have duty, but what is duty of care? My duty is to check the patient, or my duty towards my family is to earn something. My duty towards society is to behave properly. But what is the duty of care here? What care should be? The duty of care is fundamental legal obligation to ensure safety of the others and avoid acts that could forcibly cause harm. It is the fundamental first element required to prove the claim of negligence. If the patient or a person want to file a case and prove the negligence, he has to prove first there was a duty of this person towards me. Then and then only it is the he will win the case. What are the common examples? The common examples of duty of care are for the motorist, the driver or motorist, his duty of care is he owes the duty of care towards the pedestrians or towards the other drivers also, or he has to abide by the laws or traffic laws also. What is the duty of care for the medical professional? The doctors owe duty towards the patient and the third party also. What is the duty of property owners or occupiers? The property managers owe duty to their visitors to maintain safe premises. What is the duty of manufacturer? Companies owe the duty towards the consumers to ensure their products are safe. So there are duty. Only duty is not sufficient. The duty should be carefully performed. I am doing my duty. I am driving my vehicle. If I am a driver, I am taking the school children to the in the bus. So my duty is to protect the other moving vehicle on the road, the students, the children sitting in the bus also. So this is the duty of care. Let us see the Dunham versus Stevenson case. This is the landmark judgment in 1932, the House of Lords, England. It is the foundational cornerstone which has defined the legal concept of duty of care. From this judgment, what is the duty of care? The House of Lords laid down the principle. The ruling was the Dunham's favor establishing the neighbor's principle. What it is neighbor's principle? Lord Atkin, he said, you must take reasonable care to avoid acts or omission which you can reasonably foresee would be likely to injure your neighbor. Now, I will explain in simple words. It is what is Dunham versus Stevenson. You can see the picture. There is a snail, and this is the beer bottle. See this. This is a very interesting case. I think you might have heard also. Very interesting. See what is this case. The Dunham, she is her friend brought. They went to the one cafe, and her friend brought a ginger beer. The ginger beer was in the brown bottle, and then she just drank some beer from the bottle, and after some time, the beer was poured in the beer mug, and after that, she noticed there was decomposed snail inside the bottle. When entire beer was poured in the beer mug, and it was contaminated with the decomposed snail. Then how became the then how she suffered illness, gastroenteritis, and other, and she filed the case against the manufacturer Stevenson. She filed the case against the manufacturer Stevenson. Now, see here whether then how she has not purchased the beer. Her friend purchased the beer. She was not directly consumer or she was not directly beneficiary of that manufacturer, but she filed the case in the House of Lords and against the manufacturer, and the she was awarded the compensation for the and the liability was fastened on the manufacturer. That was legal principle of the neighbor's protection. The negligence of what is the that held negligence of duty of care? The neighbor's test. The Lord Atkin, what he said, a defendant means manufacturer, owes a duty of care to their neighbors. A neighbor is someone who is closely, directly affected by my act, that I ought reasonably to have them my contemplation as being affected when I am directing my mind to acts or omission in question. This is difficult to understand, but see, the logic here is because of the manufacturers, the decomposed nail in the ginger bottle, the beer bottle, they don't know, even the neighbor, her friend consumed, she was in the shoes of consumer and she was awarded the compensation that time. This is many times we have discussed what are the constituents of medical negligence. These are 4 Ds. There is a legal duty of care. The dereliction of duty means breach in duty of care. 4D, remember, these are 4Ds. Duty, dereliction. That dereliction should result direct injury. That dereliction is, suppose if I have no duty towards the patient, but there is a dereliction, there is no direct injury, it is not negligence, and that injury should result damages. Suppose if I prescribe some medicines and the patient has not taken, he cannot go to the court and he cannot say he is a pathologist how he has prescribed. He has not taken, he has not consumed. There is no duty towards my patient. There was no duty, my duty towards the patient. When the liability will be fastened? If the doctor fails in his duty of care, see the duty of care, if the doctor fails in his duty of care in deciding whether to undertake the care, whether shall I take this patient or not, what treatment should I give, and actual administration of the treatment. When the duty of care starts, this is very important. Now we will say, yes, I am a doctor, I am sitting in my chamber. When the duty of care will start? When the duty of care starts, when the doctor patient relationship starts. The moment the doctor starts to treat the patient, once the doctor starts the treatment, he must do all the reasonable, can save or rescue who is now his patient. In the hospital, the duty starts once the patient been admitted to the hospital. In the emergency, the duty starts when the patient admitted at the emergency unit, even before consultation with the doctor. Remember, if the patient brought to the emergency, the duty of hospital will start. You can't say, doctor has not come, there was no duty of the hospital. What happens if there is a failure of duty of care? If there is a failure of duty of care, diagnosis, the errors occur in the diagnosis or evaluation, the decision making, the treatment may go wrong, the medication may be incorrect dosages, further inadequate supervision of the patient, then the faulty communication, procedural complications, all are because of failure of duty of care. Now it is very interesting, few minutes, very interesting. We will discuss interesting cases on duty of care. The Barnali Chowdhury versus Woodland Medical. What is duty of care? The National Commission held medical negligence of the oncology treatment and 60 lakh was awarded to the patient. What it was? Let us see what happened in this case. It is a cancer therapy negligence decided in April 23. A software engineer about 37 years, he suffered lymphoma, NHN, non-Hodgkin's lymphoma. It is graded as diffuse large B-cell lymphoma. And he was started with MCP 842 protocol. The chemo was advised from Tata Memorial Hospital, Bombay. And patient told, I will take the treatment chemotherapy in West Bengal in Woodland Hospital. He completed 3 cycles, chemo cycles. And the second, that is the B2 cycle, admitted in the Woodland Hospital again. The anesthetist, see the MCP, the treatment protocol, there are 2 medicines, vincristine and another is methotrexate, I think. So, anesthetist injected vincristine intrathecally. Vincristine should be injected IV, remember, instead of intravenous. The patient condition alarmingly deteriorated. Immediately, patient deteriorated. Subsequently, he was airlifted to Tata Memorial Hospital, Bombay, and died within 1 week. The patient's father filed a complaint before National Commission to claim 3.1 crore, and the commission held negligence of the hospital and doctors, both the doctors, the oncologist, medical oncologist, and anesthetist, and awarded 60 lakh to the patient. What are the ingredients here? I am talking about failure of duty of care. The medical oncologist, means opposite party number 2, did not follow the instructions prescribed by Tata Memorial Hospital. What are the instructions? While giving chemotherapy or initiation of the chemotherapy, the medical oncologist should be present at the time of initiation of the chemotherapy. He was not. It is a mandatory protocol. If you refer any oncology hospital, it is a mandatory protocol. At the time of initiation, he should be there. But his defense was previous 3 cycles that anesthetist was given. He had given the treatment, so I relied upon the anesthetist. He gave the treatment last time, chemotherapy. So I told, but he denied. I did not tell the anesthetist to give the therapy. Now OP3 is the anesthetist. What happened? Anesthetist, he came directly to the room and blindly administered vincristine intrathecal. It was the utter failure and carelessness and dereliction of duty of care. See, the dereliction of duty of care, breach in duty of care of the anesthetist. So what are the ingredients here? Why the liability was fastened? Now here the tossing of the blame was there. The anesthetist said the sister brought the vial, just I pulled the medication and I injected. He wanted to shift the onus, his onus on the sister. His duty of care, anesthetist should be vigilant. He should have checked which medicine I am pulling in the syringe and which I am injecting. He can't take a defense. The sister brought, I just pulled because I was wearing the gloves. I took the wash and I was wearing, so I don't know which bottle it was. This is not the defense. The National Commission came heavily on this case, and they awarded compensation. This is again contributory negligence, one of the very, again here failure of duty of care. The patient attended the OPD in one hospital, and the surgeon just he passed the scope and found some growth in the lower end of its esophagus, G scope, and he noted there was a growth. Yes, he took the biopsy and sent for histopathology examination. He told the patient, anyway, you are going to Bombay, go to Tata Memorial and check once again and give this specimen to Tata Memorial for biopsy study. Patient approached Tata Memorial, and the doctor there, the specimen was sent for histopathology study, and doctor said, "Oh, there is a growth. Yes, let us start chemotherapy immediately. You go to your place and start chemotherapy." Patient started chemotherapy in his own, in his other place. In Bombay, there is no place, so he started chemotherapy in other district, in his native place, but there was no improvement. Doctor told, "You show this biopsy report and come again." Now what happened? Patient came after 1 month or so, after 1.5 months, and took the biopsy report. It was a tuberculosis. He approached the doctor. "I took 4 chemotherapy. There is no improvement." The doctor oncologist saw the report and he told, "No, there is a tuberculosis. So stop the treatment." Now, whether it is a correct, it is a duty of care. Who failed here? The oncologist's duty of care was he should obtain the biopsy report. After seeing the biopsy report, he should have started the treatment chemotherapy. But in this case, blindly he has started the treatment on seeing the gross findings of the esophagus, and this is the negligence as well. The patient also negligent because he has not collected the report within 1 week, but he came after 1.5 months. So it was the contributory negligence. It is the negligence of the patient also, and negligence of the doctor also. So the liability that there was negligence, but the compensation was 50%. Duty of care pathologist, the diagnostic services, how the pathologist is also liable. Usually pathologists are not directly come in contact with the patients, but still pathologists owe duty of care and failure is liable for negligence. Many times pathologists, they won't come directly with the patients. That's why most of the people prefer pathology. Once the pathologist accepts the specimen or sample, the duty of care starts. When the diagnosis is wrong or incorrect histopathological diagnosis or any laboratory test, it subsequently results damage to the patient or the unwanted treatment or unwanted surgery. That time, pathologist and that surgeon both are liable. Then again, failure to investigate. This is some neurology case. I will skip this. This is a very recent case. The date you can see 18th May 2026, last 15 or 20 days back. This judgment, National Commission pronounced this judgment, 2 crore compensation awarded against the surgeon in Uttar Pradesh. What is this case? Very interesting. I think it is highlighted in the media also, newspapers and everywhere. This surgeon, it is in 2012, the lady, she approached the surgeon for the pain in abdomen and investigated. She had hydronephrosis or some hydronephrosis of right kidney. This is the kidney. And she was operated in 2013 or 14. And that time, the surgeon, Dr. Rajiv Lochan, he removed the diagnostic report, clearly identified the right kidney was diseased. Means there was a disease in the right kidney, hydronephrosis and other. But he performed the surgery, he removed the healthy left kidney. See, what is the duty of care here? It is the utmost what National Commission said. It is the gross negligence of the highest order. It is the gross negligence. He should be attracted criminal liability also. The criminal case is going on. So he removed the left viable normal left kidney. So right kidney was as such there, but subsequently she suffered for 3, 4, 5 years and ultimately she died. So her husband filed the case and won the case recently. National Commission awarded 2 crore. It was what National Commission here? It was the gross medical negligence, deficiency in service. Boehm's principle, it is the reasonable standard of practice. Boehm's principle, we say there was no reasonable standard of practice, and doctrine of res ipsa loquitur. Anybody can say what is the doctrine of res ipsa loquitur? Anybody? Somebody should. Huh? Res ipsa loquitur. It is a legal maxim. It is things speak on itself. Suppose my right hand is affected, gangrene of left hand is there. Surgeon will cut right hand. For the Sridevi's mother, she suffered some meningioma, brain tumor in the right hemisphere. In US, they have operated left brain. It is the res ipsa loquitur. There is no need to prove the negligence. Here, there is no need to prove negligence. He has removed the left kidney. What further you need to prove negligence of the doctor? So the National Commission held gross negligence of the highest order. The hospitals and doctors can be held strictly accountable where negligence become indefensible. Here you cannot defend the negligence. There is no defense at all. So this is about doctor-patient relationship and duty of care. So if you have any questions, definitely I will be happy to answer. You can put in the chat box or openly we can discuss. Thank you. So living with litigation, just a few words, living with litigation. Remember, generally doctors' innocence is presumed in the court. The complainant has to prove doctor's deficiency or negligence, failure of duty of care with the 4D, which I explained. So thank you very much. If you have any questions, put in the chat box or email me or contact me on phone. Thank you. Right.